Nearly 1 in 4 U.S. households include someone with migraines or chronic headaches. Amazingly, 12% of the population, including children, suffers from migraines. 18% of American women, 6% of men, and 10% of children experience migraines. Accordingly, we are seeing more and more attention to migraine treatments and prescriptions. Dr. Steve Ferguson launched the Headache Management Center at Dunes Eye Consultants because of the number of patients that suffer from life altering headache events. And he also started it because he has a way to help. Today, we're going to talk about the Headache Management Center, a viable, non invasive, which means no shots, pills, surgery, or side effects, non invasive treatment option for migraine sufferers. And if you have any questions, feel free to leave a comment, and we'll be sure to answer those live at the end. I'm Mason McGrew with Kaleidoscope Marketing, and I'll be the producer today and just making sure that nothing falls apart on the technical side. So that's my little introduction. Dr. Ferguson, if you want to take it away.
Well, thank you so much, Mason, and thanks for coordinating this important discussion. And we're joined tonight. I'm excited that we have Andrea Dalton, who actually leads our optical team in the River's Edge, but is a critical teammate of ours in this headache management. And we'll learn about her role and the importance of what she does to help provide successful outcomes. And also, we're joined by my very first patient that we treated in this new breakthrough technology, Marissa Kelly. And I'll sort of talk about her and how this all started for her, and she'll share her experiences with this type of treatment as well. But I think we should at least lay some groundwork about headaches and migraines. Headaches themselves are typically classified maybe in 5 or 4 particular categories. Migraines with aura, meaning that you see some sort of visual disturbance perhaps. Tension headaches, which are sort of kind of a bilateral, both-sided type where there's pressure, and actually medication overuse. Patients that use pain relievers can have a medication overuse type of headache syndrome. And then we're introducing a new term tonight called Trigeminal Dysphoria, a brand new classification of headaches. And I really have to credit a couple of colleagues in healthcare. One, Dr. Jeff Kroll, who is an optometrist that has been the brains behind understanding trigeminal overstimulation and being able to treat headaches with a very specialized type of technology that we'll talk about. And Dr. Carol Nelson, a neurologist at Avera Headache Management, who has been a very, very profound advocate of understanding trigeminal overstimulation and is one of the key people that is involved with us in progressing this science and technology forward. So it's really been a dramatic breakthrough between eye care specialists and neurologists in helping solve problems for patients and changing their lives. In the migraine world, it's very complex. The brain itself has such an incredible pathway of nerves. The trigeminal nerve is one of the key nerves that control pain. It's kind of the center for pain management, if you will, or pain threshold. And everybody has a different headache threshold. So some patients are way more sensitized to overstimulation of the trigeminal branch than others. So you can have a patient with a similar objective finding, but a much different subjective or symptomatic finding. So that's why you see variability in this. And the severity of headaches, as we know, can be mild or sort of asthenopic or just kind of an eye strain related headache to a severe debilitating migraines. So they can be all across the board and very, very complex. What we love about discussing neurolens treatment, which is really the foundation of the talk tonight, is that there's no side effects. We're not introducing something into your body which could potentially create another symptom or change the physiology of your body. We're simply addressing the root cause of the headache. And most headache management or medic treatments are designed to mask symptoms or to stabilize the symptom development, but they're really not addressing root cause, because that would be the easiest, right? The easiest way to treat a headache. Well, we've discovered in the patients that have a trigeminal dysphoria headache, we know the root cause. And that is actually fixation misalignment. So it's related to the fact that our eyes are positioning in a manner that is not exactly where the brain thinks they are. And so the brain has to constantly readjust. And so Mason's going to show a quick little video here of really how this is happening in the trigeminal dysphoria world.
Fixation misalignment can trigger a number of significant symptoms. Because we have two eyes, everything we see is a combination of two images fused together by your brain. Each eye captures a clear photo like a camera, and your brain combines the photos, making one single image. This line of communication takes place constantly when both of your eyes are open. When your eyes and brain are aligned, this process happens seamlessly. In some patients, this communication doesn't happen perfectly. While each eye may capture a clear photo individually, if there is a misalignment between your eyes, the brain is forced to manually combine every pair of photos. This constant adjustment continually stimulates your trigeminal nerve, often causing the symptoms of fixation misalignment and trigeminal dysphoria.
So anyway, in the world of trigeminal dysphoria and fixation misalignment, it's real simple. If I close my eyes and bring my fingers together, that should align, right? But when that doesn't happen, my eyes are open, my brain has to reposition that. That creates overstimulation to the trigeminal branch. The trigeminal branch has all of these different pathways to our neck, to different regions of our brain. So we start getting symptoms such as light sensitivity. We have headaches of various degrees of amplitude. We get dry eye symptoms. Our body gets fatigued. We feel tired, but we also get significant light sensitivity. And so when you have the combination of neck pain, light sensitivity, and some form of migraine type headache or eye strain type headache, you are definitely in the trigeminal dysphoria type of category. And so what we have to treat that is we can measure this fixation misalignment very precisely, and we're going to have Andrea share with us in just a minute how that works. But then we apply a medically based contouring prism lens that looks like normal glasses, but it aligns the eyes together. It synchronizes them so there's no breaking apart and repositioning that the brain has to process. And therefore, we reduce that stimulus to the trigeminal branch. All those highways of branches are not overreactive, and the patient feels better. And it's kind of a simplistic explanation, but incredibly powerful. And so I'd really like Andrea, who works with us as a teammate in this, does the measurements, talk about her role. So once we've identified the patient is at a symptomatic patient, we then have to do a sight sync. So Andrea, could you take and run with it now, please?
Absolutely. So when we sight sync, we are measuring how well our eyes work together. And if they're not working together, our muscles need to compensate in order to see a clear image. So when we sight sync, we can measure how much near and distance misalignment is present. So also when we're sight syncing, we get to show you exactly where those misalignments are. It's so important. And then we can start the process to custom design your neural lenses to help alleviate those symptoms like headaches, light sensitivity, neck strain, and tired eyes.
Well, that's great. So Andrea, the other thing is, tell me a little bit about the role now. So we have decided this patient can be effectively treated with neural lenses, and we've got the exact measurement. I've got the prescription. I'm kind of like the orthodontics for the brain doc. Yep. I'm handing it off to the person that's actually going to construct and put together these so they work properly. And there's an optical side of this because you have to wear these, and therefore having a specifically and highly trained optician is really critical. And please tell me what the importance there is that you're playing.
Well, choosing the right frame for neural lenses is so important. We are looking for a frame that fits perfectly. We don't want to choose something that's oversized, nor do we want to pick something that's small, that's, touching pressure points or, squeezing the head, so to speak. Mm-hmm. We also need to steer away from a frame that has a lot of wrap to it. A lot of my patients that I work with, they're so light sensitive. It's a huge complaint. And also anything that's touching them can also cause a headache. So we have a lot of lightweight frames with a polarized sun clip-on to help with the photosensitivity.
Great.
Sometimes I have to tell a patient that really likes a frame, no, this is an improper fit. I have to be honest because our end goal is to alleviate symptoms. So we're going to work closely together to find a frame that they feel comfortable with, but that's going to help them see clearly. My optical team, we're all experts when it comes to frame selection, and we can also special order color and size as well.
That's great. It's a very unique, I think, balance between the traditional optical experience and then making sure we're getting the medical solution so that the neural lenses are always positioned properly in front of the eyes, but at the same time getting the aesthetics that people feel good about what they're wearing. So it is a unique part of it, and one that I don't always, get a chance to participate in because that's not my role, but it's such a valuable role to making sure that the patient gets results that they're expecting and we expect. And I think the other part of this, Andrea, that I'd like you to share with is that I've made the prescription, I've got the numbers, I know what we need to do, and I typically don't see that patient back for a follow-up for 4 to 6 weeks maybe. That interim is really important. And so the handoff, the initial delivery of these very special medical lenses is a critical piece. Please share with me what you talk to patients about.
Well, so first of all, when we find that frame that fits, measurements are crucial to aligning prism. So we need to take some time to special adjust that frame before we take those digital measurements. And we are so lucky to have state-of-the-art equipment here that's going to measure at natural posture. When we're working with somebody who solely works on a computer, again, a subjective measurement still needs to be addressed. Then it takes about 3.5 weeks sometimes to get in your neural lenses. That's sometimes frustrating for patients. They're so excited to get these new glasses. When they pick them up, all patients are different. We have some patients that adjust day one. Others struggle and have a headache for the first 3 days. So I tell everyone, put them on for 2 weeks. And you're going to notice at 4 weeks, a lot of your symptoms are starting to dissipate. We want you to keep track of all of that because any information you can provide at a follow-up helps us a lot. And I like to stay in close communication with anybody that I'm working with. But I'll tell you, to get an email or a phone call from a patient that we've helped, it's why I do what I do.
Great. It's exciting. The role that you play, Andrea, is so critical, and our other teammates out there, because they give that reassurance. They tell patients if they're feeling something, it's normal. That is such an important part to a successful outcome and making sure we get started down the pathway properly. And to help us learn a little bit more about these patient experiences, I am delighted that I have my very first patient that is wearing a neural lens for us, Marissa Kelly. And I've known Marissa and her family for quite a while. She's awesome. And Marissa's helped change my practice because of what her experience was. And I was brand new to this technology. I was introduced to it in Boston at a special eye meeting. I was asked to be considered being one of the alpha investigators. And there was a clinic already started with Dr. Nelson and Dr. Kroll doing investigative studies for neurolens treatment in headaches. And I knew that this was changing people's lives from the discussion, but yet I didn't have it in my office. And Marissa's mom just happened to tell me that she had suffered from very debilitating headaches. And they had gone to some of the top medical centers for evaluation and could not yet find the cause or a reason for these things. And I just said to Marissa and her mom, and you have to give mom a lot of credit, Marissa. You guys had gone through a lot, and to say, hey, this doctor's said, I've got this new technology that may help, and to be willing to go forward and go explore that. And of course, the results are history here. They're amazing, but it's still that impact of that first patient to me was vision so neurologic. It's so powerful. And to think that we've been able to help this patient in the manner we did, his now, I mean, it's a major focus part of my practice. And we've now helped literally hundreds of patients, really because of Marissa's experience. So Marissa, tell us a story about you and this whole thing.
When I was about 12 years old, I started getting migraines really bad. I would end up in the ER about every week to every other week. I was on different medicines. I had CT scans and MRIs to check for brain bleeds and brain tumors, and nothing was showing up. And like you said, we were at the eye doctor, and you told my mom about this conference you went to and referred us to a doctor up in Sioux Falls. So my mom took me up there, and we were talking to the doctor, and he didn't really know if this would be the best fit because at that time, they didn't have enough information, and they didn't know if it would be like, I had sporadic migraines, and they didn't know if it was for that or long-term people who had migraines every day. They didn't really know if this would work for me, but we still did the scan for it. And he set me up with a pair of neurolenses. And then I think it was about 4 to 6 weeks, I came back up to your office, and I was still having some migraines, but the severity was not near the amount. I wasn't going to the ER. I wasn't getting shots, and I stopped taking my migraine meds. And we figured out that it was working, but they just weren't the right ones for me yet. So we kept doing the neurosync test until we found the lens that matched my eyes.
Mm-hmm.
This took a while to get because I was growing, so my eyes were changing. But after I stopped growing and we found the right ones, I've been in the same pair, and I haven't had a migraine for almost 4 years because of it.
That's incredible. That's powerful. And it is, and again, I keep coming back to the statement of how just that story, you only need to hear a story like that once in taking care of patients and helping patients to realize that we're on to something very special, and it's translated into so many patients, Marissa. I think we should take credit for that major home run you hit as a softball player too, like a couple years after you got your first neurolenses, and you kept saying, I think I hit better with these things, which I think was kind of fun. Marissa's a pretty talented athlete too. So it's been fun, but it's kind of remarkable to hear that story. And I still love hearing it. And it's something like Andrea talks about. That's what brings you back to clinic, is to try to find that next patient. And what's important tonight is we're trying to just let people know there are options out there. We're not saying that every headache is related to trigeminal dysphoria. It's a subset of headaches, but it is a significant subset of headaches patients. There's so many patients out there that are using medication that may not need as much medicine or no medicine. And the headache study that was performed initially at Dr. Nelson's medical office in Sioux Falls was 179 patients in all categories of headaches. And by just doing a sight sync on all of these patients, 82% of them were symptom improved in 90 days. Almost 60% of our patients were able to reduce or eliminate medications. And that's before the deep understanding of how to specifically identify a patient that can be helped. And so that was the lead study that has set the stage. And, unfortunately, we were able to get the sight sync technology in our office soon after Marissa was in Sioux Falls, and continued to measure her. And we sometimes experience neuroadaptation. So the first set of your lenses is you might feel some symptomatic improvement, but then we have to adjust it as your brain is somewhat adjusting to the right power. And once we have it, we're set. Once we find that magic number, we're usually set, because it does not change, except if you've had a brain injury. If you've had a concussion or a traumatic brain injury, the alignment is all over the place. And we see patients, when we start treating them, we'll go through various adjustments for even up to a year or two till it finally stabilizes. And so we're able to help folks like Marissa. We're able to help patients that have suffered concussions and have traumatic brain injuries that are not getting back to their normal life. We can help children perform better in school that have maybe convergence insufficiency. My colleague, Dr. O'Neill, has helped many kids that suffer from headaches or eye strains or inability to process by simply using neurolenses to control this convergence insufficiency problem. And so we feel like we're at the tip of the iceberg of potential out there. And I just want to thank everybody for joining us tonight and helping learn a little bit about this technology, this science, this major breakthrough, this practice-changing patient care service that we're involved with. And, you know, we come to the clinic every day looking for the next Marissa. So Marissa, thank you.
Thank you.
Yeah, thank you for talking, Marissa, and sharing your story. That's amazing. And I'm looking at the comments right now. I don't see any comments. So I don't know, Dr. Ferguson, if you want to wrap anything else up, or if there's any main questions that you might get asked that you might want to answer.
I think there's two things. I see a lot of patients that come in and they've suffered from doctor or healthcare clinic fatigue. They've been to multiple places that have evaluated them and have given them perhaps a treatment option, and it may not have, it obviously didn't solve the problem, right? And it's not saying that these individuals didn't know what they're doing. Most of them are very highly trained people that do great work, but their problem was not really what was being treated. It was a different type of headache problem. And so this is such a new understanding of science that when I walk in and I'm in the room with them 5 minutes, I evaluate, look at, do a prism test, and they say, whoa, I'm seeing this change. And I know that they have a 95 to 97% chance of feeling better. It's a little baffling for them to say, I've been to Mayo Clinic. I've been to the University of Iowa. I've been to the University of Minnesota. I've been to the best of the best. And you're telling me that you can help me? And I know immediately when I see the symptoms and I see the misalignment and I have a positive test in the office, that I can help them. And then it's up to them to make that decision. And so I understand that of going, not another doctor telling me, and you know, that I can be helped. But we haven't got the exact number, but we're going to be up to 1,000 neurolens patients here before long. It's that big of a deal. And again, there's when you think of all the patients out there that have headaches, and the folks that are out there that don't know the root cause. If you don't know the root cause of your headache, you need to be site synced. You need to be evaluated for this as a potential treatment option. And so we're welcoming anybody to come in and see if this would be a possibility for them. And sometimes we have to remember headaches are multifactorial. You can have tension headaches. You can have other type of headaches that this may not address that. This addresses the neurovision symptoms that are related to trigeminal dysphoria, which are body fatigue, eye fatigue, headaches of various types, including migraines, neck pain, light sensitivity, and dry eye sensations that typically are worse when you're working on a computer. Those are classic trigeminal dysphoria type of headache-related symptoms. So, Mason, once again, thank you to you and Kaleidoscope Marketing. Marissa, thank you for taking the time out of your schedule. It's really neat that you did that. Andrea, keep doing what you do every day. It's awesome. And thanks, everybody, for joining us.
That's a perfect conclusion, but we do have one question, if you're able to answer it.
All right.
Somebody wants to know, what are some of the medication side effects that can be avoided by neurolenses, by taking neurolenses instead?
The medication side effects are so many of them, but one of the most critical ones is when I take one medicine, I develop a symptom that requires a second medicine. So it stops the domino effect, because many of these medications you take induce other side effects that need additional medicine. People would come in, they're on 4 different medications because the first one triggered a symptom that triggered, I mean, they need it to control all these symptoms. That's probably the one biggest thing is reducing the need for additional medicines by starting with one. Okay?
By not treating the root cause.
By not having to treat with any medicine at all. So I see many patients that start and they come in, they go, hey, I want to get this checked out. First, I've got an appointment to go see a doctor, start a medicine. And one of the things that's important too is to not overlook the fact that the headaches, Marissa talked about being imaged, going through an evaluation to make sure there was no physical, organic underlying problem. We have to respect headaches. They're complex medical problems. And we have to always make sure we're very comfortable in treating this without additional medical workups from our neurology colleagues or other physicians. That plays an important role in this. But if they're completely healthy and they're trying to decide, do I need to go medicine or neurolenses, I always say, listen, neurolenses first, and then you can always go to medicine if you have to.
Can I add to that?
Yeah.
When I was on my migraine med, I was on amitriptyline, and I started getting SVT and AFib from my heart. And then we went to the Heart Institute. We went all over with my mom trying to figure out what it was. And that was a side effect of my migraine medicine I was taking.
Mm-hmm.
So I was taking migraine meds for my migraines, and that was actually causing me to have heart issues.
Yeah.
So I was able to stop taking that medicine, and I've been good with these. But if I never would have had that heart issue or those side effects if I would still be having that if I didn't have the neurolens. So I hope that's a personal thing.
No, that's a classic example, Mason, of what we're talking about. Classic. And so not to say that medicine isn't important. It plays a critical role, I mean, in everything we do. But we always have to respect the fact that they have lots of potential side effects. And if we could avoid that, home run.
Wow. Well, I think that just about wraps it up. Thank you again to everybody who's watching. And visit duneseye.com to learn more about the Headache Management Center if you have any more questions or anything else like that. Does anybody else have anything else to wrap up, or should we close it?
I think I'm good. I could go on, and nobody wants to listen to me talk that long anyway. So
that's perfect.
Right.
Well, thank you everyone for joining us, taking time out of your day.
Thank you. Appreciate it. Bye now.